Now over to you, sir.
Okay.
We can start.
Yeah. Hi, good afternoon to you all. It's a real pleasure to welcome you all to this series of webinars that we are having, especially for the scalp cooling. Today is a very important day because we are having this webinar exclusively for the nurses, and it's a very important role that they play in scalp cooling. The success of the scalp cooling depends entirely on the nurses. So enjoy this program and take lessons from this program to make scalp cooling a real success in India. Over to you, Claire.
Lovely, thank you, Dr. Ashok. It's wonderful to be here today from the UK and to provide you with a presentation this morning. As many of you probably already know, Paxman are a family-run business, and my name is Claire Paxman. I'm one of the family members. So I shall start with my presentation. And here we go. Okay, so I'm going to talk to you today about the importance of nurses in the success of scalp cooling. Just very quickly before we start and for everybody's understanding, I'm just going to give you a very quick introduction to Paxman, but to help you to understand why we are dedicated to changing the face of cancer. So it's no coincidence my surname is the same name as the company because we are family run. That's again myself you can see on this picture, and Richard Paxman on the right hand side, who is our CEO, and the gentleman in the middle is Glenn Paxman, who is our founder and chairman and also dad to Richard and I. So why are we dedicated to chasing zero hair loss during chemotherapy? And that's down to one very special person. Ladies and gentlemen, I'd like to introduce you to the original pioneer of Paxman scalp cooling, and this is Sue Paxman. My mum, my beautiful late mum, who was diagnosed with breast cancer in the early 90s. The prospect of losing her hair terrified her. She did use an older primitive type of scalp cooling, but unfortunately it wasn't successful for her. This is what gave my dad the drive to develop something that worked with his knowledge and understanding of refrigeration and cooling liquids. For my mum, it was the worst point of her cancer diagnosis. To lose her hair had a huge impact on her, and this is what we see every day. And again, what gives Paxman the passion and drive to make a difference, along with our wonderful partners such as Access Devices. My mum, when her hair started to fall out, actually asked myself to cut it off. I was only 14 at the time. So we understand the psychological impact that CIA has on people going through cancer treatment. So it's really important that we understand all of these elements when we are looking to treat people with scalp cooling. And this is where we really come into where the nurses, really do play that important role in towards the patients having successful outcomes. So if we look at the psychological impact first and where this plays a part, and why scalp cooling is so important to offer to your patients, and to have a deep understanding of why losing your hair is so devastating. So it's also important to sometimes, it's very easy to have a medical mindset, but when we're thinking about things like this, it's really important for us to have that mindset of putting ourselves into our patient shoes. So taking that medical mindset away and thinking about them. Because many people do actually consider hair loss as the most feared and common side effect of chemotherapy treatment. It's the fear of the unknown. It's about that outwardly visible sign of the disease and not having privacy and being able to manage their chemotherapy and manage their cancer diagnosis. So if we just look at some other key factors as well, is that it is the most feared side effect of treatment in over 75% of patients. Again, often the most traumatic side effect of treatment and can lead to social isolation. People need to and should have normality during their treatment. They should still be able to live with their cancer diagnosis and not feel that they can't live the life that they are having and that they deserve. So this is what the areas that we need to think of and consider. It can affect self-image more than breast surgery. Breast surgery is much easier to cover up and to disguise. Yes, we have wigs and head scarves, but again, they're still very much a signpost to that someone is ill and going through treatment. One of the other factors that we need to look at as well and to consider is the driver of wanting to keep their hair may not necessarily be that individual, but actually their outer circle, their family, particularly young children. It's very difficult for young children or any child to see their loved one with no hair. Again, it's that constant reminder that they're the other side again is the privacy. People want to be able to still work or still have a social life or be able to do those day-to-day tasks without having to tell people or have people, as harsh as it sounds, but pointing or knowing that they're going through cancer treatment. The most shocking statistic that we have is that 10% of patients actually refuse chemotherapy or request a less efficacious treatment in order to keep their hair. So that in itself really shows and proves just how important and how devastating hair loss is. We also have to consider as well that it's now been published that patients receiving adjuvant treatment with docetaxel, the cumulative dose of 400 micrograms per metre squared, is associated with significant rate of grade 2 persistent alopecia in about 10% of people. But it's actually shown now that the toxicity is completely stopped with scalp cooling. So all of this is important that we understand the drivers, we understand the emotional toll of why people should be having access to this treatment and why we should be providing the best treatment as possible so that we can manage these traumatic side effects of chemotherapy and cancer treatment. And so that we can give people, and you as the nurses, can give people control, normality, confidence, privacy, and empowerment through their treatment. So now let's have a look at some of the clinical data, which this is actually we can see that the nurse's role has made a positive impact on the success of scalp cooling results. So we'll first look at the Netherlands study. This initially was started in 2012 and was published in 2015, and it's an observational study of scalp cooling in the Netherlands, and it reported at the time of publication a mean success rate of 48% in 1,411 patients treated with chemotherapy for a range of different cancer types. And we can see from the table on the right-hand side the different types of chemotherapy and the percentage of patients that did not need to wear a head covering. So what's important to see is that this has now been republished last year, and the study now has collected data in over 7,000 patients in 68 Dutch hospitals, and now reports a mean success rate of 57%. And the efficacy has increased due to the improved usability. But one thing is really important to look at in this data is the variation in the results per hospital. So if you can see from the table here, just on this section here, you can actually see that there is a huge variation in the results. Now, the main reason for this and the attributes to this is depending on the competency and expertise of the clinical staff. So as I say, the better results are attributed to the hospitals with a higher competency and expertise in scalp cooling. And this actually means that, or you can see that the mean success rate would have been higher if all hospitals had had the same competency and expertise. Sorry, was that a question? I didn't quite get that.
No, there's some disturbance, Claire. Just carry on.
Oh, okay, I'll just carry on. Apologies. Okay. So then if we then move on to the next study, this is looking at a German study which was published in 2018. This showed that scalp cooling successfully prevents alopecia in breast cancer patients undergoing anthracycline and taxane-based chemotherapies. So it was a prospective observational study including 131 women with breast cancer. The success was measured by patients if they retained more than 50% of their hair and didn't require a wig, and failure was patients losing more than 50% of their hair and requiring a wig. But if we just again refer to the actual table here, so this was patients treated with an anthracycline and taxane-based therapy, and 74% of patients were treated with that. And then there was 26%, sorry, of patients receiving a taxane monotherapy. But if I can guide you to the actual success rate for weekly dose of the anthracycline and taxane, we see percentage success rate of 76%. And 3 weekly 59%, and this is much higher than we do normally see with these types of drugs, in particular the anthracycline and taxane therapy. And again, the main attributes to the success of this study, in comparison to other studies using the same device and caps, is that the clinic and nurses were all experienced and well trained in the use of the systems. All users had a proficient understanding of the cap fitting and the importance, the critical part of the success of scalp cooling. It is the protocols and the actual cap fitting, and also specific recommended scalp cooling hair care measures were adhered to. So all this information in understanding the importance of scalp cooling for patients, the impact of CIA, chemotherapy-induced alopecia, and the improvements in clinical data really highlights and demonstrates how important the role of you, the nurse, plays in ensuring that patients have the best experience and outcome, with scalp cooling treatment. Thank you. Any questions, or are we doing questions at the end? Apologies, Ashok.
We'll keep questions for the end, after your concluding remarks. Okay.
Okay. So I hope that was useful and gave a really good insight and understanding how important the nurse's role is.
Yeah. So can we go to Amish's clinic? Kalpesh?
Yes, sir. Hello. Hello.
Yeah, Kalpesh?
Yes, sir. Tell me.
Can we go to Saneesh?
Yeah, sure, sir.
Yeah.
Can you hear me?
Yes, sir. We can hear you.
Hi, everybody.
Hi, Saneesh.
Hi, sir. How are you, sir?
Good to see you. Yeah.
Pankti, share the slides, please.
Can I start?
Yeah, sure.
Yes.
Yes. Hi, everybody. Thanks to inviting your faculty invitation for the webinar on managing hair loss with the scalp cooling today. My name is Saneesh Kumar, working as a brother in charge since last 3 years in Hope Oncology Clinic. Today, my topic is counseling and setting expectations about scalp cooling. Nurses having very important role in the success of scalp cooling. If we are put the cap is not properly in the patient's head, that will not affect the. Then we are put the conditioner properly, directly in accurate condition, that will not result in the scalp cooling. Hello, Smaker.
Hello, Mr. Saneesh.
Yes, yes.
Sir, sorry to interrupt you. While you are speaking from a hands-free, na, just put some distance from your mouth in the hands-free, so the voice will be loud and clear.
Okay.
Yeah.
Yeah. Hair loss is pure vanity. 88% of patients refuse to take chemotherapy because of hair loss. Then the patient is refuse for scalp cooling. We can counsel for the no, sorry. The patient is refused for chemotherapy because of hair loss. Then we can counsel the patient to if the scalp cooling is given, the hair loss will not occur. 70 to 80 percentage is not occur. We can counsel them. 20% more patients go into depression after hair loss episode. Cancer patients successfully treated for depression do better compared to those who are not. If the hair loss is not occur, the patient will not go to depression. Hair loss is the main cause of that will decrease their confidence and normal activity in daily life. Hair loss is announcement to the world about the disease. Hair loss at work, home can create prejudice. Means the patient is refused to go outside with the colleagues, then with any parties. They are not confident for that. Proper consent has taken from each patient before scalp cooling and before taking photos. And in our clinic, we are following the in every time in every cycle we are taking in every weekly taking the photos, and we are sharing the photos to the whole staff. How much is the hair loss is there or not? We can check in every week. All then we are made a group. Then we are sharing the photos to the everyone. Then all photos are real patients photos only. In we are mostly using in breast cancer, soft tissue sarcoma, porphyrin, eribulin, ovary, NHL cases. We have defined success by two parameters: visual impression and patient satisfaction. Then we are putting the calculating. We are explain the all procedures, A to Z procedures. We are explain to the patient. That's why they can know how is going on, how much time will take, what all are the procedures. Then before we are taking the doing the procedure, we are taking the consent for the scalp cooling. Because of that, the in between any problem is there, then sometimes the patient having maybe sick like shivering, then fever, chills. That's why we are taking the consent before that. Conditioner is applied on scalp so that hair gets stuck to each other on maximum area. Scalp skin is contact with scalp. This is mandatory except one patient. Then when we are starting, we are applying conditioner in very heavily. After that, we got information from the researchers that that will not affect the conditioner will maybe little, that will more effective. Nowadays we are putting some lukewarm water. First we will brush it. After that the little conditioner will put. After that the cap will fit it. That is more effective for us than our study. The machine is started. After 5 minutes it shows ready mode. 5 to 15 minutes will take, the machine will be ready. When the cap will apply, then the pre-medication will take half an hour. That's why the pre-cooling will be over. For 20 minutes the freezing means the temperature is -1 to -2. Like that will be applying. Chemo will start. Freezing sensation reduces. First 15 minutes the patient can survive. Then the patient will do the full scalp cooling. Sometimes the aged patient can't survive. Then chills, shivering, headache, severe headache will be happen. Sometimes we will remove that. Freezing sensation. In we are giving chemo in 3 to 4 hours. The maximum interval is 15 minutes in 5 in 3 times. Maximum one time interval is 5 minutes. Above that we will not allow them. Chemo is over. After that 90 minutes we are giving the post cooling in every patient. Total 90 minutes post chemo. Then we are in 3 to 4 times the cap is fit or not. In between we will remove the upper cap and will check. Then we will fit again. Then we will ask to patient, how is your feeling in all over the scalp is cooling or not, temperature will affect or not. Conditioner is very little bit. Then we are advised to patient come with one warm blanket, and we are providing 3 to 4 blankets to the patient. Sometimes our machine will be repairing in between. The display will off. The time we are facing many problems. Okay. This is our hope team. All our the nurses, doctors, all are there. That's all, sir.
Thank you, Saneesh. Shall we do the next speaker? I think MC Ghatkoper are the next speakers, right? Pankti, can we go to the next speaker?
Yes, sir.
Thank you, Saneesh.
Welcome, sir.
Sir, if you can announce who will be the next one, sir?
That is the MOC Ghatkoper team.
Okay.
Hello, Miss Vijaya.
Hi, Pankti, Vijaya here. Can you share
Yes, ma'am.
screen?
Ma'am, please go ahead.
Hello, good afternoon, everyone. Myself, Priyanka, sister. This is a Paxman machine, 2 caps.
Today you are going to tell about.
Next.
तू सांग ना ते बोलत जा मराठीमध्ये बोलून जा.
ही पॅक्समॅन मशीन आहे. ही आमची सिस्टर शारदा.
हिंदी में बोलना.
फर्स्ट है स्विच, मेन स्विच. नेक्स्ट मेन स्विच ग्रीन कलर. जिस पैक्समैन मशीन का ये स्टार्टेड पैक्समैन कूलिंग का लोगो आता है. स्टार्ट सिस्टम कूलिंग प्लीज वेट. कूलेंट का टेम्परेचर आता है. नेक्स्ट पैक्समैन का स्टेज आता है. This is a small cap, medium cap and large cap, 3 caps. पेशेंट के हेयर में कोई क्लिप है क्या? हेयर वॉश करके आए क्या? ऑयल नहीं लगाना चाहिए. नेक्स्ट पेशेंट का हेयर गीला करना चाहिए. नेक्स्ट कंडीशनर.
बाद में थोड़ा सा कंडीशनर थोड़ा सा अप्लाई करने का है, थोड़ा.
पेशेंट को हेडेक होता है, कैप का लगता है, इसके लिए गॉज पीस रखते. नेक्स्ट कैप स्काल्प कूलिंग है, पूरा अटैच होना चाहिए. नेक्स्ट कैप का ऊपर का कवर पूरा अटैच होना चाहिए. राइट साइड एंड लेफ्ट साइड कैप का पूरा बेल्ट टाइट है कि नहीं. नेक्स्ट पैक्समैन का कनेक्ट किया हुआ. And first stage starts 45 minutes. Second pre-medication 45 minutes. First stage. Second 1 to medicine start and third stage post chemo 2 hours.
बेसिकली आप बताओ कि क्या पैटर्न में पता लगता.
बोला उनको अप्लाई करना.
You want to see a live demo? उनको पूछो, मैं करता हूँ
डेमो दिखाऊं क्या? हेलो हेलो.
अगर आप रेडी हैं तो डेमो दिखा दीजिए. आप दिखाते हैं.
ओके सर.
ऑन करती हूँ पहले तो बेड पे जाने को दिखती है.
Can we share the screen? They'd like to show that live demo.
Yes, sir.
Yeah, they want to show the demo on a patient, how to do the cap fitting. So it will benefit everybody to see how they're doing it.
Okay, sir.
Can you see? Can you see the patient?
Yeah.
Okay, so this patient is first checked whether the patient has washed the hair properly. There is no oil on the hair. Everything is being checked properly. She is examined for any clips or any sharp objects that she may have worn to assemble the hair. Once it is clean, then they are going to apply the cap. Before applying the cap, they are going to put a band kind of a thing so that the ice, water, or
on the front, on the face, she does not develop any reddishness on the skin. They are going to apply a little bit of water so that there is proper conduction of heat, or basically the cold is conducted properly to the scalp. So they are going to spray a little bit on the hair. Now they are going to apply the conditioner. Can you see the conditioner? So they are going to apply the conditioner now a little bit so that there is proper conduction of body heat right to the cap, and cooling is transmitted right to the scalp. Generally, before applying the cap, you have to check the size of the cap before you fit to the patient. If you fit it to the patient, if it is a large cap and not up to the patient's skull size, then it is going to be loose. So I am just trying to show you that if there is a larger cap, once the cap is fitted, the cap is loose. Okay? So you have to check whether you have got the correct size of the cap and then apply it under the patient. You can apply the smaller cap now. There are 3 sizes of cap. Small, medium and large. So you have to check for the exact size that is going to fit to the patient. Now you can see that they are checking the small cap fits perfectly. Okay. And now what she has done is she has unfolded upside down the cap, and now she is going to apply this portion of the cap. This is the insulator cap basically, which will go on top of the main cap. So she puts her hand on the scalp, not pressing too tight. We do not want cervical fractures. So just unwrap the cap back onto the head and then tighten around the chin as she is showing you. So now the cap is snugly fit.
Pulling it from the back side also, so that the back portion also tightly fixed.
Basically what they are doing is they are pulling the strands, okay, and they are checking whether the cap is snugly fit or not.
They will pull from all the sides and they will ask the patient whether it is tight or not tight. Once the patient says it is tight and they are comfortable with it, then they will go to the next step. The next step is like attaching the piston to the tube to the main strap.
Jigish, can you show how do you check whether the cap is snugly fit or not?
You check from all the 4 sides whether it is tight. Ask, see if this thing lock is properly tightened up. Pull, see if there is any bulge around. Now you can see there is no bulge. You can see there is no bulge around. It's plain. When it's plain, then you ask the patient if the inner cap is touching your scalp everywhere. Once it is touching everywhere, then you are confirmed that it is fixed properly. Then you connect the tubing to the main tubing.
એટલે જ્યારે આપણે સ્લાઇડ ઉપર જઈશું ને ત્યારે વિડિયો એકમાંથી ક્લિક કરો. હા એક વાર તમે પ્રેઝન્ટેશન ક્લિક કરી જુઓ તો વિડિયો
You should get a click sound when you put both the things.
હા તમારે ક્યાં
If you get a click sound, you're sure that the tubing is put in properly. You see the backside is not clinked or something. So to avoid all possible obstructions.
केबल निकाल दो प्लीज. Can you turn around?
You need to leave if the patient is having a long hair.
So before we want to ensure that this portion of the cap is snugly fit. Okay, this has to be, there should be no kink at this area. If there is a kink in this area, there is going to be a possible obstruction to the flow, which is not good. So you have to ensure that the entire connection is proper, right up to the cap and up to the system. So you have to ensure that this connection is exactly proper and it is not kinked otherwise. And when the patient lies down, ensure that this comes from below, from the foot end and not from the cranium end. It should not flip around and go from the upper side. Okay, so Jai.
The patient is lying down also.
See, we are showing you when the patient lies down. Okay, the cap, the cable should not kink. Can you see?
Yeah.
So this is very important because if the cable is kinking, then there is a possibility that there can be obstruction to the tubing, which is not good because it is going to obstruct the tubing one and it may even tear the tubing. All right. We want to show you the screen. So the patient is ready now. So we are going to administer the patient. So we are going to start a pre-medication. So pre-medication is set for 45 minutes. Okay. So this is the stage 1. So we are going to run the stage 1. I'm going to press and it says kindly check the connections and then continue. We have checked the connections. So now the cooling has started. And you can see here the timer is going to count down. If you want to increase the timer, you can extend the timer by 15 minutes more. All right. And you can see the patient is getting proper cooling. All right.
Okay.
Thank you.
So this is stage 1.
Any precautions to be taken, Jigish, while fitting the cap?
Yes, you have to ensure that when you are tightening the cap, I want to show you that when you are tightening this cap, the insulation cap on top of the main cap, you have to ensure that you do not tighten this so much that the rivet goes and hits the main cap and punctures it.
Silicone cap.
The silicone cap should not be punctured. So if you feel that it is not fitting properly, then you can put in some gauze pieces in between and then tighten it further. When you tighten it further by pulling this, the rivets will not hit the cap when there is gauze piece in between. So it is better way. Another thing is if the scalp is not uniform and if it is not fitting properly on the scalp, then it is necessary that you put in the gauze pieces here as well. Okay.
They have done this for some.
So they have done this for some patient, as you can see. They have put in extra gauze pieces and put it with a sticking tape so that there is no way the rivet is going to hit the silicone cap.
Okay.
And it will not puncture it. Because we have seen some damages with the rivets onto the silicone cap which causes the leak. All right. This is one precaution we need to take. important thing is that you have to ensure that the entire silicone scalp is touching the scalp. Sorry, the silicone cap is touching the scalp. So you have to ask the patient whether she is feeling the uniform cooling throughout the scalp. If she is not going to have uniform cooling throughout the scalp, she can have patchy hair losses. Should I say it in Hindi as well?
No, that's not required.
Yeah.
Jigish. I think it's pretty clear.
Okay, so this is one precaution you have to take. You have to ask the patient, uniform cooling हो रहा है ना? सब जगह uniform है. You press it and ask. There should be no air pockets. There should be no air pockets. So you have to ask whether the cooling is uniform. If she says yes, then we can go ahead with it. Okay. So after the first stage, we go to the second stage, which is during the chemotherapy, which is a long stage. And once the chemotherapy is finished, patient or patient's relative will inform the nurses, and then they can go in for 2 hours post chemotherapy,
Depending on the protocols.
And Jigish, in the patient record, you also mentioned the size of the cap, right? So that next time they don't need to do the same practice.
Yeah, every patient is recorded.
Every patient is recorded for the cap, and in the sheet that they mention, they clearly write that this patient was administered with a small cap, so much was the timing, and all those records are maintained very well.
Yeah.
Any
Okay.
questions?
For the coolant is also maybe sufficient, right?
Yeah, coolant is always sufficient. There will be alarms if the coolant is not sufficient.
So when I'm going to give the troubleshooting, we are going to create alarms and we'll show it to you.
Okay, Jigish. Thank you very much to the MOC team from Ghatkoper for this wonderful presentation. Thanks to Jigish and Prakash. I think we can move on to our next speaker, who is Dr. Goutham from Amrita Institute, Cochin. He will be talking about cooling times. Over to you, Dr. Goutham.
Yeah. Good evening, everyone. Can someone upload my slides, or should I upload my slides? Yeah. Thank you, Access Devices, for giving me opportunity to present this, and Paxman solution also. My topic is today's topic is scalp cooling timing. Actually, in our I'm Dr. Gautam from Amrita Institute. Our institute, especially we follow these timings for all regimens, irrespective of the cancer, irrespective of the regimen, irrespective of the drug we are giving. The minimum recommended pre-cooling time is 45 minutes, and the infusion time, the next is the infusion time, which is the time to infuse chemotherapy drug. That depends on the individual regimen, and the post-cooling time, the minimum post-cooling time we are following is 90 minutes. And for some patients, we are on a trial basis, we are doing it for 2 hours also, to see the outcome, whether if any difference is there or not. Next slide. So all the pre-med to be administered during the 45 minutes pre-infusion time, and the patient must wear the cap throughout the pre-infusion cooling, chemotherapy drug administration, and post-infusion cooling. Next slide. So this is I just put the chemotherapy drug chart just to explain, like the red labeled the drugs or the pre-medication part of the chemotherapy chart, and these drugs administration, I think should be finished the pre-medication, that pre-cool, that is 45 minutes time. And the second part is the infusion time, that is azithromycin and cyclophosphamide. That should be it's around 35 minutes or so. That is the infusion time. And the next, the normal cell and everything, the post infusion time, that post cooling, post infusion time, that is minimum of 9 minutes. So this is for AC chemotherapy regimen. And the next slide. The same way here also, just put for an example, this is a paclitaxel. We are getting a lot of good results for paclitaxel. The red label drugs are given in the pre-infusion time and the paclitaxel in infusion time. After 1 hour, 9 minutes, we are giving the post-infusion. So, next slide. Yeah, this is docetaxel and cyclophosphamide the same. Yeah, next slide. Next slide. So we usually explain everything to the patient before starting the cooling, scalp cooling. The patient is permitted to take short toilet break. As said the previous speaker said it's like not more than 5 minutes. The cap line to the system should be disconnected. The patient should not remove the cap, and after the break, cap line should be reconnected to the system. The nurse should ensure the line is properly connected, and scalp cooling will automatically resume after that. The duration of the break should not be 10 minutes, but in our institute, we are just practicing 5 minutes. Care should be taken to ensure the patient does not walk away without disconnecting the line. This could damage the cap. We have some suggestions to both access devices and Paxman. Is that like it's better that you can prepare one brochure to the patient? Yeah, brochure to the patient. Like the brochure should contain all the like what are the precautions they should take while they are on scalp cooling, with images and timing and explain brief explanation about how the scalp cooling works in patient words. I That will be helpful because we are facing a lot of problem in explaining this. Actually, this technique is actually new to all the patients. In fact, it is new to all the doctors also. And in a busy schedule, like we really can't take much time, like 15-20 minutes or so in sitting and explaining. So in that part, there is miscommunication with doctor and patient. So I feel a booklet or some brochure should be printed, and that if we give it to the patient beforehand, before the first session itself, they will read that, and we can later if they have any further doubts, we can answer to it.
Yeah, good suggestion, doctor. We'll definitely implement this soon. We'll definitely do it soon. Yes, sir. Thank you for the suggestion. Yeah.
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 Okay. That's a practical problem we are facing here. That's what
Yeah.
I want.
You do understand? Yes. Yeah.
And I hope that booklet will contain everything, like even the application of oil, everything properly.
Yeah.
Minor details should be included in that, because and a short notes about the results of scalp cooling. If you can introduce in that book, that also will be helpful. Because
Yes,
nowadays
sir.
all the other patients are asking me about the results of the scalp cooling, what are the studies and all. So yeah, definitely you can include in that booklet. It will be easy for to explain for them also.
Okay. Yeah.
Yeah.
We'll take your inputs also while designing the booklet, and we'll come back to you very soon on this.
Yes, yes, yes. Thank you.
Thank you. Thank you so much.
Thank
you. Yeah.
Yes.
I think we'll go to the next speaker, right? Can we go to the next speaker?
Yes, sir.
Yeah. Is Shiny also, Miss Shiny also online? Jigish is going to talk next on the troubleshooting.
I can't see the participant, so I'm not sure if she is online.
Okay, anyway, you go ahead.
Okay. Can you ask the MICE team to play the presentation?
Sure, sir.
Yeah.
Okay, this presentation was basically prepared by Shiny. We had helped her to prepare this. So we are going to talk about the basic troubleshooting that every nurse is going to face during the application of the Paxman. Okay, so can you go to the next slide, please? Okay, so this is how we are going to attach the coolant lines and disconnect the coolant lines. Now, if you everyone can see on the side of the cap and on the side of the patient tubings, there is one male and female connectors. They have to be inserted only in one way, and you have to hear a distinct click sound to ensure proper connections of the cap. And for disconnection also, you have to press the white button very gently and effortlessly. The connectors will come out of the main connections and you can disconnect the lines. Can you go to the next slide, please? Okay, this is how the cap is to be applied and it is how to be connected. Now, what all problems you are going to find during this application of the cap is, like we showed you during the short demonstration, either the cap is loose. If the cap is loose, we have to ensure that we check the right size of the cap which is to be taken. Once the cap is applied, there could be a possibility that the scalp is not uniform. If it is not uniform, then we apply a lot of gauze pieces in between the silicone cap and the insulation cap to ensure a proper connection between or conduction of the heat between the silicone cap and the scalp. Okay, can you go to the next slide, please? Now, I want to show you that these are the minor problems that you will see during the fitting of the cap. If you try to fit the cap very tightly, sometimes the rivet goes and hits the cap and it causes minor leakage, which are not very visible, but eventually a lot of liquid is going to leak out and it is going to make the patient completely drenched with the coolant. So you can see, and there is if you see in the medium cap, you can also see the serial number of the cap. So you have to ensure and you have to note and keep the serial numbers copied and placed in a safe place so that we can address the problems. I want to ensure that there is no kink in the cap. You can see in the last image on the right bottom side corner that there is a kink in the cap, which the way it has been placed. If there is going to be a kink in the cap, it is going to tear off from the junction where the cap is connected to the silicone cables, and that is going to create a problem in the long run. Repeatedly kinks in the cap makes the tubing very, very vulnerable to cracks. Can you go to the next slide? Now, once we saw in one of the hospitals, that is in HCG Nashik, the patient started walking when she wanted to go to the washroom without getting the cap disconnected. Eventually what happened was the cap got stretched and the tubings got stretched and the tubings got inflated and it caused a balloon-like structure to form at the edge of the cap and eventually the gap burst. Okay, so you have to ensure that the tubings are not very much stretched. The tubings has to be loose and the patient has to feel comfortable. Neither the cap should be stretched, neither the tubings on the machine side should be stretched. If such a bubble happens, I request you to kindly switch off the machine, call the engineer immediately and kindly drain the entire tank. There is a drainage kit provided. Drain the entire tank, start the machine once again so that the bulge disappears. Call the engineer and kindly decommission the machine till the time engineer resolves the problem. Go next. I want to play the video here. Go back. I want you to play the video here, please.
Yes, sir. Just a second.
Now you can see that if the rivet goes and hits the cap, there is a small, kind of a shower which comes out, and you can see the cap is leaking continuously. So we do not want this kind of situation to arise. That is why we put gauze pieces in between the rivets and the silicone caps. Go next. There is a definite rupture of the tubing at the junction of the cap and the silicone tubings. This has happened due to heavy kinking of the caps. So kindly, whenever the patient is sleeping, there is a possibility that the patient is uneasy. So because she is feeling a lot of cold on her head, she is going to move from right side to left side, whichever, and she is going to wake up and get up and sleep again. The nurses have to continuously watch so that there is no kink in the cap, as what is shown on the right side. If the kink on the cap is there, or if the tubing is taken from it is flipped on the cranial side, it is going to cause a heavy kink. This is going to stop the flow to the cap as well as rupture the cap, rupture the tubings as well, probably. We do not want this situation to occur. So I am requesting all the nurses, whoever is watching, and all the doctors, whoever is watching, that they have to instruct the nurses to continuously watch the patient and instruct the patient to avoid any kind of kink at whichever point in the tube. This is my humble request. Go next. Now, as you can see, once it is ruptured, this is on the left side, the tubing has ruptured, the balloon which was there. Yeah, kindly take the mouse up near the thumb, yes. The second thumb below. Yeah, so that side you can see the tubing has ruptured and the connector is split open and the entire coolant has leaked out. When such a thing happens, kindly switch off the machine. Switch off the machine and call the engineer. Do not switch on the machine, or whatever the coolant is there inside the machine is going to all be pumped out of the machine. Please help us and do not switch on the machine and kindly call the engineer. This is on the tubing, yeah, where the mouse is. Near the thumb you can see, yeah, that is the tubing which is ruptured, yeah, that one. And on the right side you can see the cap is ruptured and it has caused a massive leak in the cap. All right, go next. So this is the screen that you will see. Now, once you start this screen, you can see that on both the sides there are stage 1, stage 2, stage 3. Many a times we get a lot of call from nurses who ask us that we have already completed the pre-medication. Now how to proceed further? Or during the pre-medication or during the chemotherapy, there was a power failure and the machine was switched off. No problem. In such a thing, if it happens, you can again start from stage 2, continue till the time the entire chemotherapy is completed, and then you can go to stage 3 automatically. Now, many a times what happens is they have had a power failure when stage 2 was completed and they were going after the post cooling period. Doesn't matter if there is no timer or anything on stage 3, you can please proceed forward. Keep it on for as long as possible. The main idea is to keep the scalp cooled. Forget all the timers, forget all that. And if a power failure occurs and it is going to be long, take ice packs and put it on the scalp. Go next. Now, in one of the places, we had seen that the chemotherapy drug had spilled on the screen. So we got a complaint that saying that the screen has got a black blob on the screen. And on the right side also you can see on the above the word Paxman, there is a lot of blackening in the area on the top corner. Yeah, that corner, yes. So what happens is you have to protect. This is a touch screen, okay, so it has got an active inputs available. you should not allow any kind of liquids to be spilled on the screen. Again, if such a thing happens, it is important that you decommission the machine and call the engineer. Okay, and you have to protect the screen. What you could do is, you already have some kind of face shields available with you. Either you can use the face shield, or you can use any plastic or any kind of sterile drape or something that you can apply, and you can protect the screen if you are going to have chemotherapy going to be dripping on the machine. Kindly ensure that no liquid spills on the machine. The machine is sensitive, and if there is any spillage on the machine or electronics, it is going to get damaged. Go next. You can see clearly you can see the liquid being spilled on the screen. You can see on the right side, you can see this. Can you see my screen? Okay, can you move the mouse please on the right side? On the right side. Yeah, you can see those water droplets coming down on the screen. Yeah, those ones. So kindly ensure that there is no liquid which is falling on the screen. Go next. Okay, whenever the coolant goes low, whenever the coolant is low, it will give you on the left side, it is going to first give you an alarm, low coolant, please top up. But it will allow the cooling to happen. So you can complete your chemotherapy cycles, you can do all the necessary treatment and then call the engineer. Or even during chemotherapy, if the nurses are trained to top it up, you should top up the coolant. On the right side, sometimes when the coolant is empty and you are starting the machine for the first time, allow the system to cool till the time the coolant temperature, which is shown on the top side of the screen, okay, it has to cool down to -4 degrees centigrade. Now when you see this on the right side of the screen, where you can see above V2.0.5, that is the version of the software, you can see it is showing 131 degrees centigrade. If it is showing you 131 degrees centigrade, we are definitely not in a desert. We are definitely not in some area which is on the Venus or something. So we are 100% sure that the thermistor is fired. When the thermistor is fired, okay, okay, there is a question. I'll answer that question a little later. When the thermistor goes bad, it is going to show you a temperature 131 degrees centigrade. Can I answer your question, Dr. Megha? Now? Yes, we have to apply water before the conditioner if possible. If there is no water applied, but if the conditioner is completely properly applied, then we don't require the water. But it is always better that water and conditioner combination is always better, so that the scalp is effectively cooled. Have I answered your question? Dr. Megha, have I answered your question?
Jigish, can we take the questions after you complete your presentation, please?
Okay, go next on the next screen, please. We have seen that sometimes there is a possibility that the biomedical engineer opens the system and then does the check. And if during the check, if there is liquid spillage into the system, then it is going to cause a massive short circuit. We request you, do not open the machine till the time Paxman engineer arrives on site. Go next. Yeah. So we are through. These are the problems we have faced. Is there any particular problem anybody else has faced which I can answer? I'm ready to take the questions now.
I think if there are any questions, we can take them now before Claire makes the closing comments. I saw a couple of questions on the screen earlier. If there are any questions, can we address it now?
And my ideas should get the questions, right?
Yeah.
Sir, already I have put in the chat box. 3-4 questions are there, so you can share the questions with the team, sir, so they can answer.
Okay, these are none of these are questions. Can you answer the questions, Ramesh, please? Ashok, can you answer?
I'm not able to see the questions.
Okay, the first question is, why are the cap leaking many times after Paxman therapy starting? From Tejasvi Parab.
Yeah, I'll answer that. We've had a few issues. It's, I think, more to do with part of our learning curve with the Paxman. And as you said, a lot of time it has been with either the rivet or our own understanding of how to handle the caps. And that is why we've had problems. And I mean, these issues are part of our learning curve, like with any other technology. And with most of the, I'm sure most of the users will confirm that as they have gone ahead with more therapies, they have become more comfortable with the system. What is the next question?
The next question is, what are the chances of... Sorry, somebody was speaking. Can you repeat?
What are the percentage of preventing hair loss due to chemotherapy drugs, which causes alopecia by providing cool cap scalp cooling? So I know I covered a few clinical data, a few pieces of clinical data in my presentation, but we are across the board of all studies and chemotherapy regimes. We are seeing that you have between a 40 to 50% success with anthracycline therapies, whereas with taxane therapies, anything between 70 to 90%. But what we would always recommend to manage patients' expectations is that we say it's a 50-50. So one in two chance of retaining 50% or more of your hair. We do have now on our latest and our brand new website for Paxman, which is coldcap.com, and you can actually add in the country that you are in. There is a decision-making tool. So this is a really helpful tool for patients and for you, the nurses and clinicians, to add in. You can go and add in the drug, and you get an even better percentage if you can put in the dosage as well. But this is the main aim as well, is for patients to retain 50% or more of their hair. I hope that answers that question.
Thank you, Claire. Actually, Manoj had a couple of questions where he was talking about scalp cooling causing hair loss. No, the idea is we are trying to prevent hair loss. So scalp cooling does not contribute to hair loss. And the other question he had is whether certain things contribute more to hair loss. Yes, they do. For example, if you use very, conditioners or shampoos that are very chemical dependent, they can affect your hair post scalp cooling. So I'm sure now most of the hospitals that are using scalp cooling have their own protocols, which they are suggesting to the patients. But generally, what we recommend to, as an overall thumb rule that we tell patients to do, is once they've had scalp cooling and they go home, we recommend that they do not use very hot water to clean the hair. And basically for 1 or 2 days, they just finger brush the hair or use combs which have white tooths, so that it doesn't disturb the already fragile hair that they're having. So these are small things that can contribute. But one thing, Manoj, the most important thing is the nurses counseling the patient is the most important thing. Telling them what are the strategies that they need to take to make sure that they avoid hair loss. So if there's anything from the panel, we'll welcome any questions if there are any more questions from them. If not, we'll pass on to Claire. So any questions? So So shall we proceed with the closing comments from Claire? Okay, Claire, it's all yours.
I have a question.
Yeah.
Yes, doctor.
Gautam had a question.
Yeah.
Yeah. To Mrs. Clara.
Yeah.
No, I just wanted to know, ma'am, what percentage of patients are opting for scalp cooling, like in other countries? Just for an idea, like in UK.
Sorry, you broke up a little bit then. Could you?
I think Dr. Gautam's question was what percentage of patients, like for example in the UK, opt for scalp cooling?
Actually go for scalp cooling. Well, gosh, I'm not quite sure on the exact percentages, but to give you an idea, here in the UK we have 98% of both public and private hospitals have Paxman systems, and a large number of those have a high volume. So for example, Royal Marsden Hospital in London, who are a very large scalp cooler, have scalp cool many patients, they are scalp cooling between 10 to 15 patients a day. And this is the same that we see in other major cancer centres as well. So there is a large proportion. It depends again on how well accepted the scalp cooling and how well it is used in the facility, and how much again the nurses and the doctors advocate it. So this again shows where it's a huge part to play in how it's successful, but also how well it is adapted in the facility.
Yeah.
Does this answer your question?
Yeah, thank you.
Excellent. We are working very hard to provide the correct information and to make things as simple as possible for the nurses to be able to provide the treatment, and such as the cap fitting and the instructions, and also the use of the system, which we like to think is a very simple, intuitive system to use without many faults. Again, if the systems and the caps are looked after properly.
I really heard about that website. What is scalp website? Some new website you told about.
Yeah, it's called coldcap.com. I can add it to the chat, so that you can utilize it. And as I say, I am multitasking now. There we go. Oh, that was private. Sorry. I shall make sure that I send it to everybody, or Vice, if you could share that, please. But yeah, the website will adapt to whichever region that you have stated that you are in.
Is that website for healthcare professionals or patients too? Is that for patients too?
So it is mainly focused for, it's a patient focused. We do strongly recommend that people from whether you're clinical can go on there as well, because again it's very, very useful. There is some excellent tutorial videos on there as well, and lots of helpful information in terms of managing expectations of scalp cooling, how patients can prepare themselves, what to take with them for treatment, and how best to look after the hair during treatment as well.
Yeah, and I think in India, rather than these websites for the patients, like booklets will reach. They rely more upon the direct booklet which we give to them.
Okay.
So that's my request, like to provide a booklet of all instructions, precautions, every minor detail about scalp cooling to educate them. Yeah.
We can work with Ashok and Ramesh, and in all of the relevant information, as we've also developed brand new booklets as well, which I know my colleague James, who works with access devices, that we can help and support in anything that you need to make sure that the booklets are the best, the patients are getting the best information.
Thank you.
No problem. We're here to help.
Yes, Claire, is there anything else you'd like to add as a closing comment? I think we have reached the end of the thing. Before you start, there was one question from one of the sisters who wants to know if the scalp cooling is comfortable for the patient. If I can answer the question, I would say yes, but it takes a little getting used to. This has been our experience. Initially, the patient may feel a little uncomfortable, which is why it's necessary for us to counsel them and tell them that initially, because this is at almost 0 degrees, they are going to feel a little uncomfortable in the beginning. But once the chemotherapy starts, it's at a very comfortable temperature for them to manage. So sometimes the apprehension they feel about the cold is only during the pre-med period, which happens during the first time that they're scalp fitted. Once they get used to that, it's very comfortable. I hope I've answered the question.
Yeah, and I think I will echo those comments as well. It is the first 10 to 15, 20 minutes that if people find it uncomfortable, and it is just about the fact that you are acclimatizing, because we are rapidly taking the temperature of the head down from around 37 degrees down to a temperature of between 18 to 22 degrees Celsius. This is the optimum temperature for scalp cooling to be successful. So we're doing that in a very, very rapid succession. So if to give an example, for if people have jumped into the sea and it's very, very cold, your body acclimatizes to it. Again, if you have anything cold or go into a cold bath or an ice bath, it is very similar. Your body takes a little time to acclimatize, but using certain measures, again, to making sure the patient is as comfortable as possible, ensuring they have protection on their forehead. You saw in the demonstration earlier that they had protection on the forehead. This is so avoiding that cold cap touching any of the skin. This helps massively. And there's also lots of other things that people can do, such as distraction therapy, so deep breathing, drinking a hot drink, putting themselves in a different place, reading, or even doing something on their phones, or all sorts of these different things, such as distraction therapy, just to take the mind off that first 10 to 15 minutes. But we do see that less than 5% of people do actually stop due to it being uncomfortable. And preparing people and also explaining the temperature of the scalp helps as well. Yes, we are using a sub-zero coolant, but understanding the temperature of the scalp all goes towards managing their expectations. Okay, would you like me to close on to finish some remarks? Yes. Okay. So, it's been my pleasure to be here as a representative of Paxman today. Thank you very much to Access Devices for both running this webinar and for inviting me. There's been lots of information that's been shared today. I hope it's been incredibly useful for you all, and for you to see just how vital and important a role that you do play in helping people to go through their cancer treatment. Again, I'd like to think that you can see that the simplicity of using the device, the importance of the cap fitting, ensure that that cap is fitted correctly and that you are using the correct size cap, and also adhering to all of the measures of ensuring you are looking after the equipment, ensuring you've got no kinks in your lines and that cap is on properly, and the storage of the cap. And again, the system as well is being looked after. Imagine having your iPhone before it's an 11 and you couldn't get it wet. These are similar things that we need to look for. But it would be an absolute pleasure to have anybody and to as part of the Paxman family. I hope that you saw from my presentation at the beginning, it means the world to us. We are on a mission to improve the effectiveness of scalp cooling, and with the Paxman we've made lots of improvements along the way, and we continue to do that, and with the fantastic support and partnership with Access Devices as well. So thank you from me, thank you from the Paxman family, and I do sincerely hope that you found it interesting and useful.
Thank you so much.
Thank you.
Thank you. Bye-bye.